It was another year of ups and downs in our healthcare system as hospitals struggled to keep up with demand and workers recorded high levels of burnout. But it wasn't all bad. We have seen some new ways for doctors to practice in other provinces more easily, and there is some improved access to medical data. For all of this, we are joined by Dr. Kathleen Ross, president of the Canadian Medical Association. Welcome, Dr. Ross.
Good morning.
Let's start with what clients in the system are currently dealing with. There are currently now more than 6 million Canadians who do not have a primary care provider. They're using emergency or walk-ins. There are still surgical backlogs, around 327,000 long at last count, and healthcare worker burnout. More than 53% of physicians reported experiencing it. So what are 3 things that we need to be doing right now to start taking a look and fixing some of these problems?
So first, acknowledging the challenge, I think, is critically important. And then recognizing that in 2023, we saw, more funds committed to healthcare than we've seen in the last 2 decades, over $200 billion in the next 10 years. And very importantly, an additional $25 billion that is for individual provinces and territories to taper their responses to their unique healthcare needs in their provinces. And yet we only see 3 provinces so far that have committed to those bilateral agreements. And those bilateral agreements required something a little different that's not been required, uniquely. Increasing access to family health services. Absolutely. As a primary care physician, I know this is the foundation of our healthcare system in Canada. Supporting healthcare workers so they can stay working in their job, reducing those backlogs, improving access to mental health and substance use, and modernizing our healthcare system and how we collect data and use digital tools. Those are all commitments that are required.
Some people, including primary healthcare providers, will say that is a really great amount of money. Some of it's new, some of it's not, but some of it's a little bit, it's too late for some systems. I mean, it's not that they're breaking, they're broken.
Well, I think it's never too late. We have to start with where we're at, and although we can look backwards and see this crisis evolving over the last many decades that I've been in practice, it's time for us to get moving. And what I found most promising this year was the commitment across jurisdictions, provinces, territories, federal government, all pulling in the same direction, all saying these are the challenges that we face, these are the things that we need to tackle, and we need to get moving on them now.
You're right. They are unified in identifying that this is a crisis and it needs to change. On the good news side, we saw the creation of registries and legislation. This allows physicians to practice outside their home provinces a little more easily, so improving access to harder to reach areas. How does this tackle issues that we're seeing nationwide?
So this is one of the solutions that we've proposed to try and make our workforce more sustainable and more nimble, particularly for rural and remote areas. And I do applaud, the Pan-Atlantic Registry to allow physicians to move seamlessly between the 4 Atlantic provinces. And Ontario recognizing the multi-jurisdictional license of physicians, but actually also other allied health professionals. This is critically important, but it's not the only solution. We need to be retaining our workers, we need to recruit more workers, and we certainly do need to be training more. And we saw commitments across Canada to exactly that in this last year.
Healthcare data and the collection of it, I know that was something that's been pushed for a long time, and that looks like it's coming into play. Remind us of how it helps.
So there's multiple different ways that health data helps. The first is to actually understand our health workforce. Who's providing what services, where are they providing them, under what circumstances, and where are the gaps? That's critically important. But actually also having the ability to share data between providers across sites, from in-hospital, out-of-hospital, even across city lines. Unfortunately, sometimes that data isn't interoperable. And we know that interoperability reduces repeat tests and actually saves patient lives.
Dr. Ross, it is a tough role, especially when we're taking a look at how challenging it is for clients in the healthcare system, but there are improvements, as you point out, on the way. Thanks for joining us, and happy holidays to you.
Happy holidays to you too. Thank you.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.